Good afternoon and welcome to our webinar, 2020's Remarkable Research Methods. My name is Kristen Rottinghouse and I'm a Performance Audit Manager with the Kansas Legislative Division of Post Audit. I will be moderating our webinar today. I'd like to thank the National Legislative Program Evaluation Society and the National Conference of State Legislatures for sponsoring this webinar. NLPES is the NCSL Staff Association for legislative staff involved in program evaluation or performance auditing. One of its key purposes is promoting professional development opportunities like this webinar for legislative staff. So we're pleased that we could bring you this program today. This webinar is being recorded and will be archived on the NCSL website. Over the next 60 minutes, we encourage participation through our chat box, so feel free to type your questions and answer any questions in the chat box, which is in the lower left-hand corner of your screen. To build some comfort with the chat function and learn who is on the line today, I invite you to type in the state you're calling from now. While you all are doing that, I also want to mention the resources for the webinar. Above the presentation, you will see a couple of tabs. One is labeled Resources. Here you can find and download a PDF version of the PowerPoint as well as other handouts. Another tab is labeled Speaker, and this is where you can read short biographies for today's speakers. You can access these tabs at any time during the presentation. We will take your questions after the presentation, but feel free to enter your questions in the chat box at the lower left side of your screen at any time. Today's presentation will be split into two parts. First, we'll hear from Casey Radostitz and Joshua Karras from the Washington Joint Legislative Audit and Review Committee. Then we'll hear from Ryan Tolman from the New Mexico Legislative Finance Committee. With that, I'd like to introduce our first speakers, Casey and Joshua. Welcome, and please take it away.
Thanks for that great introduction. I'm Casey Radostitz, and Josh and I are both staff to the Joint Legislative Audit and Review Committee, which is the nonpartisan program evaluation unit for the Washington State Legislature. We're here to talk today about the methods we used in our evaluation of the Opportunity Scholarship. And our presentation today will be pretty technical. Some might even say nerdy, so hopefully that's what you signed up for. If it's not, we do include a methodology appendix in our report that is written for a broader audience if you're just interested in the highlights. So for today, I'll give you a brief overview of the Opportunity Scholarship Program and our approach, and then I'll turn it over to Josh to tell you about the modeling we used to develop a comparison group. So the legislature created the Opportunity Scholarship and Opportunity Expansion programs in 2011, and at the same time directed JLARC to conduct a review of the programs. The scholarship provides funds to students, while the expansion program provided 3 grants to higher education institutions before the funding mechanism for that program expired. And while we reviewed both programs, our presentation today will focus on our analysis of the Opportunity Scholarship. As a bit of background, the Opportunity Scholarship provides up to $22,500 in funding over 5 years for eligible college students. It also provides wraparound supports such as peer and industry mentoring. Students are eligible for a scholarship if they are a Washington State resident with a family income below 125% of the median family income, are pursuing a bachelor's degree in an approved major, such as computer science, engineering, or nursing, have at least a 2.75 GPA, and have an eligible class standing, which means they're a high school senior, college freshman, or sophomore when they apply. And between 2012 and the 2018-19 academic year, the Opportunity Scholarship awarded 21,000 scholarships to more than 10,000 students. The legislature created the scholarship with the intent of helping make college more affordable and increasing the number of degrees in high demand fields. And our job really was to help the legislature understand whether the program met these goals. And so some of the questions we tried to answer with our analysis were, was college actually more affordable for opportunity scholars? Were opportunity scholars more likely to return to school or graduate than other students? Did the scholars earn high demand degrees? And how did opportunity scholars' employment outcomes compare to other students? And to answer these questions, we needed two things, a comparison group and outcome measures. So we reviewed academic literature, guidance from the federal government, and spoke with higher education experts to define specific metrics for affordability, graduation, and employment. And some of the key metrics include net price or out-of-pocket costs, student borrowing, and student retention. And Josh will talk more about those later on. Next, we used student-level higher education data combined by Washington's Education Research and Data Center to identify a comparison group. And we were fortunate that Washington already has a pretty robust education database with information for students attending public higher education institutions. The data included class-level information, which meant they were very large with millions of records. So we used an SQL server to store the information and R to pull specific subsets of data. This data is also linked to employment information. And our goal with this was to create a comparison group of students who would have met the Opportunity Scholarship eligibility criteria, but did not receive an Opportunity Scholarship. And the data set had fields for residency, high school graduation, family income, GPA, and whether a student filled out a financial aid application. However, it did not include a reliable way to identify a student's intended major. And our literature review suggested that a student's major may influence some of the outcomes we were interested in. And so we wanted to develop a way to include intended major in our comparison group. And Josh is going to tell you a little bit more about the approach we use to identify a student's intended major.
As Casey mentioned, when identifying students pursuing an approved major, we weren't confident that we had up-to-date data regarding a student's major. One of the challenges is that students often don't choose or record a major until after their first or second year, and there's a misalignment with the timing inside the data. We considered counting the number of STEM classes each student took, but general education requirements include both non-STEM and STEM classes, and our initial analysis showed that many students took similar number of STEM classes in their first year. Some classes seem like they are more indicative of STEM or not STEM though. As an example, what if a student took electromagnetism in their first year? Or what if a student took an entry-level mathematics course? With that in mind, we opted to use class-level data from past STEM graduates to help develop our model. For the rest of the presentation, we will be discussing our approach to classifying students as STEM or not. We will build this model because we needed to identify which students were pursuing an approved major. And here are the general steps we took to developing our predictive classification model. First, we flagged every graduate as STEM or not STEM, and we flagged every class they took in their first year. Second, we clustered every class based on the proportion of STEM graduates that took that class in their first year. Third, we built the predictive model using a training set of graduates. And then finally, we tested the model with cross-validation on a testing set of graduates. To identify who graduated with a STEM or healthcare degree, we used the Opportunity Scholarships approved majors as the basis for what STEM and healthcare was, which included majors like computer science, engineering, and nursing. And if we refer to STEM later in this talk, we really mean the STEM and healthcare approved major list. We flagged students corresponding to the zip code of their first degree obtained. If a student received multiple degrees simultaneously, we considered them as STEM if at least one of them was STEM. Because we planned on clustering classes based on the proportion of STEM graduates that took the course, we also merged the STEM flag into the class data as well. At this point, we have a STEM flag on roughly 14 million class records, and a little more than 100,000 graduates. Here are 3 quick examples. These are the percent of graduates who took each course in their first year and earned a STEM degree. Electromagnetism was roughly 93% STEM, business writing was 0% STEM, and intermediate algebra, which is technically a STEM course, was only 23% STEM. That means that these classes would likely be good indicators of pursuing a STEM degree or not. Electromagnetism is likely more indicative of a student pursuing a STEM degree than business writing. The second step in developing the model was clustering all of the classes. The idea here is that we would place the classes with similar proportion of STEM graduates into groups together. Given that we have no predefined clusters, this will be done with unsupervised clustering, and in our case, we used k-means clustering. K-means clustering works by partitioning n elements into k clusters while minimizing the total within cluster variance. As an example, in the top visual, these 4 classes could be placed into a single cluster together. Or in the bottom visual, which is likely more appropriate, is to place intermediate algebra and general psychology together in one cluster, and then linear analysis and electromagnetism into another cluster. We found that 4 clusters sufficiently minimized the total within cluster variance, and to place some human interpretability on the clusters, we also labeled them. Group 1 has the lowest proportion of STEM graduates. We considered this to be the group of classes that were not STEM. While Group 4 had the highest proportion of STEM graduates, we considered this to be the group of STEM classes. Every class was placed into one of these groups, and I've listed a few examples on the slide. So we will be counting the number of classes each student took within each of these clusters. Say a student took 10 classes from cluster 1, it seems like they would be pursuing a non-STEM degree, while if a student took 10 classes from cluster 4 in their first year, it seems like they would be pursuing a STEM degree. And we want to develop a model that uses this information to classify students as STEM or not. The third step involves building the model. As I mentioned, the general idea was to classify students as STEM or not based on the number of classes they took in each cluster. Our approach to this is using a generalized linear model. For that, first, we subset the graduates into a training and testing set. 80% of graduates are randomly selected for the training set. Our independent variables are of the multinomial distribution. That is, we're counting the number of occurrences from k groupings. And our dependent variable is binary, 0 meaning the student was non-STEM, and 1 meaning the student was STEM. That means we'll be using a generalized linear model with a logit link. A support vector machine would have also worked here instead to classify students. We see classes in cluster 1 are negatively associated with STEM, while classes in clusters 3 and 4 are positively associated with STEM. We also give 3 hypothetical examples of students. Student A, who took many classes in clusters 1 and 2, who earned a non-STEM degree. His GLM output is close to 0, while a student who took many classes in clusters 3 and 4, which is student B, and earned a STEM degree, has a GLM output close to 1. The GLM output currently does nothing without some designated threshold where values above that are classified as STEM and values below that are classified as not STEM. The fourth step was to test our model using cross-validation. First, we used the receiver operating characteristic curve and Yoden's index to determine an appropriate threshold for STEM versus not STEM. And this value is 0.31. Yoden's index is the threshold which balances observed type 1 and type 2 errors in the testing set. In the visual to the right, that's the point closest to the top left, which we have highlighted yellow. So GLM outputs at or above 0.31 would be classified as STEM, while GLM outputs below 0.31 would be classified as not STEM. This predictive model correctly classifies 82% of the known graduates. Of the known STEM graduates in the testing set, 81% of them were correctly classified. And of the known non-STEM graduates, 82% of them were correctly classified. We also tested this using the Opportunity Scholars that have graduated, and it correctly classified 88% of them. 95% of the known Opportunity Scholars that earned a STEM degree were correctly classified, whereas only 51% of the Opportunity Scholars that earned non-STEM degree were correctly classified. And reasons that the model may not correctly classify students include a student swaps or changes major after their first year, or they were near the threshold because their class load looks similar to either a STEM or non-STEM graduate. Using the predictive model to classify students as STEM or not, we found 29,848 students that met all of the eligibility criteria to receive the scholarship, and we used them all for the comparison group. Once we had the comparison group and the Opportunity Scholars, we used a simple linear regression to compare the Opportunity Scholars to their peers that did not receive a scholarship on key metrics. Our analysis found that Opportunity Scholars have lower out-of-pocket costs, or net price, than their peers, take out fewer student loans, and when they do take out loans, on average have lower loan amounts. Collectively, our analysis suggests the scholarship was meeting the legislature's goal to help make college more affordable. Our analysis examined student retention and found that Opportunity Scholars return to school in their second year more often than their peers, which suggests the Opportunity Scholars are more likely to continue their education and graduate than other students. We were only able to offer preliminary information about the employment and earnings of Opportunity Scholars relative to their peers because many scholars were still in school at the time of our evaluation. However, we found that a higher percentage of Opportunity Scholars are employed in Washington 1 year after graduation than their peers, have higher average annual wages when employed full-time, and when employed full-time are more likely to earn middle-income wages. While the data was limited, the initial results suggest that the scholarship is on track to help students enter middle-income jobs. For our final remarks, we'd like to note this study was not causal. The selection of Opportunity Scholars was not randomly assigned, and there may be unobservable characteristics we couldn't control for. The outcomes are not a causal treatment effect. And finally, some key takeaways. First, much of the higher education data is protected by federal privacy laws, and if you're doing an education study with individual level records, you'll likely encounter FERPA and need to be aware of it. Second, there are many powerful tools to cluster and classify observations that can be used, like k-means clustering, support vector machines, and general linear models. And finally, I think the most important point to take away would be whenever you're developing a model of any type, would be to use training and testing sets so that you can do cross-validation on the model's outputs. Thank you for the opportunity to speak today. We are happy to answer any questions, and here's Casey and I's contact information, and a link to the full report is also provided. Thank you.
All right, thanks so much, Casey and Josh. Just one last reminder to all of you who are listening, don't hesitate to use the chat box that's in the lower left-hand corner of your screen if you do think of questions as we're going along. So now we'll move on to the second portion of today's presentation. Our second speaker is Ryan Tolman from the New Mexico Legislative Finance Committee. You're free to take it over. And I will advance your slide.
Well, great. Thank you so much. Hello, everyone, and thank you for having me today. My name is Ryan Tolman, and I'm a program evaluator with the New Mexico Legislative Finance Committee. Today, I will be discussing the research methods and analyses used in our evaluation of the effectiveness of the state's Child Care Assistance Program. First, I really want to thank all my co-authors on this project, Dr. Sarah Dences and Janelle Taylor Garcia, and all of my other colleagues here at the LFC who helped contribute to this project with me. one thing I'd like to point out is how the New Mexico LFC is structured and operates, and how this helps us tackle budget and policy questions like this. So here at the LFC, we have program evaluators like myself working alongside the budget analyst and economist. This really helps us identify budget and policy issues that we can then begin to ask important questions and evaluate the issues. We typically approach our evaluations through the legislating for results framework. So in general, as the diagram on the right shows, these steps are rather interlocking. But first, we might look at performance data through agency report cards to identify policy and program areas that may need additional oversight and attention. Next, we might start evaluating the program effectiveness and looking at what's working. As far as funding, we'll make budget recommendations regarding programs that are working and yield a high return on investment. Part of the evaluation might entail determining if we are implementing the program with fidelity or figure out why it might not be working as planned. As evaluators, of course, we're often concerned with program outcomes and making sure we are achieving the desired results. So let's take the current example of the state's child care assistance program. So in New Mexico, families making 200% or less the federal poverty level are eligible for child care assistance. So the graph on the left plots the enrollment in child care assistance and the monthly average cost per child over the last few years. We found that enrollment has only increased by 4% since 2013, but the rate per child has increased by 72% over that same time. So in other words, the state isn't necessarily serving more children and families, but we're paying a lot more for it at a total cost to the state of $139 million. So from a budgetary standpoint, the state is clearly investing a lot in its child care assistance program. And so for us as evaluators, we want to see what kind of value we're getting from this investment. So, and first, let me explain a little bit about how child care assistance program works in New Mexico, as this guided a lot of our specific evaluation questions that we asked. So as you can see by the graphic on the right, child care assistance in New Mexico is one of the programs in the state's early learning system, which also includes home visiting, IDEA Part B and C programs, Head Start, and New Mexico Pre-K. Child care, like some of these other programs, are geared towards an early learning intervention to help reduce educational gaps as children enter kindergarten. New Mexico has aimed to improve the quality of child care overall through the years through the use of tiered quality rating and improvement systems. New Mexico is actually one of the first states to implement such a quality rating system, and now we are on our third quality rating system known as FOCUS. This is also around the time when we saw an increased cost of child care assistance to the state. So for us as evaluators, we wanted to make sure that the FOCUS quality rating system was achieving its goals. Effectively, FOCUS operates as a rating system for child care providers. There are registered homes, and then child care centers are rated from 2 to 5 stars, as you can see on the left. Child care providers are rated on a list of 10 quality indicators on such factors as environment of the center, providing developmental and health screenings to children, and staff qualifications, training, and education. One of the biggest differences between a 2- and 5-star child care center, and also the biggest cost driver, is ratios and group sizes. So, for example, a 2-star center is allowed to have a ratio of 6 infants for every adult supervisor, whereas a 5-star center is only allowed to have 4 infants for every adult supervisor. And so the state seeks to incentivize this higher quality through differential reimbursement rates, as you can see on the right. So at that 5-star center, an infant is reimbursed at a rate of $1,271 per month, which is more than the lower rated centers, and thus incentivizing them to provide a higher level of care. So child care in general has many goals. So for one, we want it to be a safe and healthy place for children. The child care assistance program also aims to provide a form of income support to families, allowing them to stay in school or help advance their careers. Among the many other goals, we also want childcare to help prepare children for school and close existing education gaps. And so with so many goals, this certainly poses some challenges in how to evaluate the program's success. But in general, I'm going to focus on two main evaluation questions related to these goals in today's presentation. So first, did children who received child care assistance have better outcomes? And secondly, did children who received higher rated child care have better outcomes, particularly in regards to educational achievement? With so many goals of the child care assistance program, this creates a lot of challenges. For one, program data and related outcome data is located in multiple state departments and agencies. We actually ended up pulling data from 4 different state agencies: the Children's Family and Youth Department, the Public Education Department, Human Services Department, and Taxation and Revenue Department. For child care assistance data, we first had to pull together data from multiple data sets, including federal ACF data, which included enrollment data and family demographics, child care provider data, which included service data regarding the child care centers, including their star levels, and state child care assistance data, which included additional demographic data on the children. This data came in monthly files that we had to append and link together for within the study's time frame. For education data, we had to link together student demographic data, their student achievement data, particularly beginning of year assessments at kindergarten, and then 3rd grade assessments in reading and math. For child health data, the Human Services Department provided Medicaid data, which included things like well child visits, dental checks, and immunizations. For family income information, we worked with the Tax and Revenue Department, who provided us with family income entry and exit for the program. It's shown as a dashed line on the slide, simply because they weren't allowed to give us data. We actually had to work with them and give them data, and they did a lot of the analysis along with our study. Just simply because they weren't allowed to give us data. So this required us working with all of these different departments and agencies. The state has been investing in an integrated data system for some of this, but it's still yet to be implemented on our state. So with the data sets coming from many different agencies, one of the challenges was how to link them. Each department might utilize their own unique identifier. For example, the Children, Youth, and Families Department uses a case ID, and the Public Education Department utilizes a student ID. So in order to get around this, we had to create our own unique ID to link across all of the data sets. So to do this, we first looked for common identifying elements across agencies, such as names, date of birth, social security number if it was available. Next, we then just simply combined the multiple common identifying elements through concatenation to create a unique ID. In this case, since social security number wasn't always available across data sets, we used mostly name and birthday as an ID to link across all the data sets. Next, we utilized the unique ID to combine the data. Here, we combined the child care data with the student outcome data from the Public Education Department as an example. So through the merging of the data sets across departments, we were able to identify cohorts of 3- and 4-year-old children who participated in child care between 2015 and 2018, and then follow these students over a 6-year period, including participating in child care, pre-kindergarten, their beginning of year scores in kindergarten on a test called iStation, and their end of year scores on math and reading. We identified over 43,000 children between January 2016 and June 2019 who participated in child care assistance. For the kindergarten analysis, the 3 identified cohorts of students were actually merged together to ensure adequate incisors for analysis between the child care star levels. We limited the analysis in cohorts to these years because student assessments had changed in prior years, so we wanted to have cohorts that were somewhat comparable with student assessments. However, this data organization allowed us to evaluate our two primary questions. One, does child care assistance have an effect on school readiness? And does it have lasting effects on third grade educational achievement? So this evaluation study posed methodological challenges that we attempted to address through our analytical approach. For one, we simply couldn't run a randomized control trial and test the effects of child care assistance and different levels of quality on childhood outcomes. Really, we were just limited to archival data and the data available to us. Another issue is the potential for a fade-out effect. So meaning by the time a student reaches third grade, that school or school district or their teacher might account for more student progress or lack thereof than participation in an early childhood program. Another issue is that of selection bias into the child care assistance program. Simply because these children come from low-income households, one might expect these children to typically score lower on academic measures. So given these methodological challenges, it was important to select an analytical approach that could help us address some of these challenges. Therefore, we actually selected two analytical approaches and looked for converging validity in the results. So the first analytical approach we selected was that of hierarchical linear modeling, or HLM for short, which is represented on the left-hand side of the slide. So the HLM approach is relevant here because it reflects the multi-level nature of the data. For example, students are nested within child care providers, which are nested within schools, which are nested within school districts. Now, these aren't perfectly nested relationships, as we discovered, since children at one child care center might actually go to various different schools. But being able to consider the outcome data in each of these nested contexts and interactions among them can help with understanding of the various contributing factors, such as individual demographic characteristics or school district policies. These statistical models were therefore built to consider these multi-level data. Specifically, they help determine the contributions the child care providers, school district level variables, and individual level variables have on outcomes, and to control for these contributing factors when looking at participation in child care assistance. In this way, the model helps control for fade-out effects by controlling for these interacting effects at these different levels. The second analytic approach that we took, which is represented on the right hand of the slide, was the use of propensity score matching, or PSM for short, to try to identify a potential comparison group. Since this was not a randomized control study, this approach helped us minimize the impact of selection bias by identifying an approximate comparison group based on similar factors as our child care assistance group. So how does propensity score matching work to identify a comparison group for analysis? Essentially, we are statistically trying to create as close to an apples-to-apples comparison group as we can. So in our example, participation in child care assistance is largely based on income qualifications and poverty status. In the graphic, this is the child care intervention group in the top left, represented as red people with apples for their heads. We estimated that only about 20% of children who are eligible to participate in the program are actually enrolled in the child care assistance program. Therefore, there are other children out there in the state who could have been eligible to participate in child care assistance but didn't, that we could try to identify as potential comparison group. These children are represented by the black figures with apples for heads mixed in with all the people with oranges for their heads, who would be ineligible for the program based on income qualifications. They're in the bottom left of the slide in the potential comparison group. Through the use of propensity score matching, we statistically try to create a comparison group that is most similar as possible to the treatment group based on relevant factors. Again, we were limited to the data available to us, but we utilized free and reduced lunch status as an income eligibility indicator, English learner status, students with disability status, and school districts to create the matched comparison group for more or less apples-to-apples comparison. Of course, there's still limitations to this approach. For example, we had no way to identify whether those in the matched comparison group had also attended child care, but just weren't receiving assistance. We also couldn't determine whether they had attended other programs like Head Start. So therefore, we pursued both analytic approaches and looked for converging validity in the results. So here for the educational outcomes, we present the findings from the propensity score matching approach, but we did generally find the same results for both the HLM and PSM analyses. So in terms of school readiness, we did not really find that children who participated in child care assistance were any more school ready than their peers in the PSM matched group, as you can see in the graph on the left. Among our third grade cohort, we found a similar pattern, as you can see by the blue bar on the right-hand side. We did observe, however, that children who participated in New Mexico pre-K did tend to be more proficient on reading assessments compared to those who were in child care assistance and their comparison group. Next, we looked at whether children in higher rated child care providers had better educational outcomes. And here again, we didn't find any significant differences to indicate that higher rated child care providers led to improved student outcomes. And this is important for us because 5-star child providers cost the state about 171% more than home-based care. Although we didn't find much effect of child care assistance on educational outcomes, we did find that enrollment in the program was associated with an increase in income for participating families. On average, families who participated in the program experienced an average increase in income of about $3,500. This was much higher than would be expected due to inflation, which is indicated by the dark blue bar in the left-hand chart. We also found that while many did decrease in income while enrolled, the majority of participants did experience an increase in income, as you can see on the right. We also found that enrollment in child care assistance was associated with significant increases in health outcomes like well child visits and dental visits. Although these were positive outcomes, there's certainly room for improvement. And we also didn't find a significant difference in rates of immunizations. So just to summarize the results in our findings, we did find positive outcomes associated with child care assistance in regards for children's health outcomes and family employment and income. However, we didn't really find much of a positive effect for school readiness and long-term student achievement. Regarding some of the other goals of child care, like social emotional health and development and family engagement, we weren't able to evaluate them simply because they weren't being measured. And so for the most part, the state isn't measuring or reporting many of these outcomes related to the program goals. And so despite all of our attempts to address methodological issues through our analytic approach, this evaluation still had some limitations. For one, group selection for the matched comparison group was limited by the data available. Since Head Start data was not available, we were not able to determine potential impact of this program. Additionally, only children tracked for child care were those receiving subsidy, so this meant that the matched comparison group that did not have any record of other early childhood services being delivered and could have still received private paid child care. New Mexico also lacks the definition of school readiness, and so is not tracking these types of indicators or outcomes for the child care and pre-kindergarten programs. Some of our key recommendations from our evaluation included, one, allowing the Taxation and Revenue Department to share tax return information with appropriate agency and legislative economists. This would certainly help in evaluating the economic effects of state policies and programs like this. As you saw by how we had to merge different data sets from across different state departments, the state could regularly start tracking and reporting outcomes related to the child care assistance program, and that could also include other goals of the program, such as child social, emotional, and physical health, as well as the parental employment. We also recommended that the state should study the possibility of including outcomes for child care assistance as a metric of quality. And finally, we found one of our big findings was that quantitative assessments of teacher-child interactions in classroom environment, which in our literature review and research indicated we found to be the most influential factors in child care's effects on eventual student outcomes. Those measures were actually dropped in the state's current quality rating system. And so we had recommended that these could be incorporated again. And so I want to thank you all so much, and I'll be happy to hang around to answer questions. And there's also my email in case anyone wants to contact me with questions.
All right, thanks, Ryan. And thank you, all three of you, Casey, Josh, and Ryan, for your presentation. Very interesting work. So now we'll move on to the Q&A session, the question and answer period. We have plenty of time for all of you who are on the line still. It looks like we have about 15 minutes to take any questions that you have. So if you haven't already done so, please do type your questions in the chat box. Again, that's on the lower left-hand side of your screen. So I will try to take those questions in the order that they come in, and we'll try to get to as many of your questions as possible in the time that we have left. And with that, actually, we had a couple of questions come in through the chat box already. I know that, Josh, it looks like the first two are coming to you. But we'll go ahead and ask them just in case someone wasn't looking at the chat box, or if there's anything that you want to add. So the first question came from Eric, and he asked, what % of students in the comparison group who got a degree got a STEM degree?
This is Josh. Can you hear me?
We can.
As far as students overall, roughly 25% of all students earned a STEM degree, and then within the comparison group, the students we selected, it was roughly 80%, and I want to say it was 82%, but I may be misremembering. And so we had run this model by higher education experts, and they were expecting accuracy of more around 50%. And so we figured 80 to 82% was a good benchmark for model accuracy.
Okay, and the second question, also to you, Josh, is from Norman. Would you need to track this kind of data over a period of time before making a supportable assessment of whether the program is accomplishing its goals?
And to that, I would say yes, because you want observable outcomes for program participants. And so for a scholarship, typically students will enroll for 4 to 5 years in higher education and then graduate and enter the workforce. And so depending on the study questions you have, that will determine how many years of of data that you need to make any assessment of a program. And so if you're evaluating the rate at which program participants of a scholarship enter, say, middle-income jobs, you need at least 1 to 2 years post-graduation for each of the cohorts and students.
Excellent. And now it looks like, Ryan, we've got a couple of questions for you as well. So the first one is just clarifying, what does fade-out effect mean?
Yeah, thank you. Just real simply, it just means how long the effects will last. So in the case of child care assistance, like how long can we expect the effects to be? And so if the desired outcome is educational achievement, like how long might that effect last? And so that's one of the reasons why we measured at beginning of kindergarten, so we can see that immediate effect. and then also in 3rd grade when hopefully that effect is still apparent.
Okay, and then a second question for you. How were the 10 essential elements of program quality designed? Sorry, this is jumping around on me a little bit, but for example, did they come from Focus, the New Mexico Early Learning Council, New Mexico Legislature, the literature, maybe something else?
Yeah, I think it was mostly by the Early Childhood Learning Council and Children, Youth, and Families Department. I think part of it was modeled, some of it came, I think, from pre-K standards and also national accrediting standards. There are national accrediting bodies who will accredit child care centers, and so they were meant to be in line. The 5-star ratings were meant to be in line with these national accrediting bodies. And so I believe that's how they helped shape the 10 essential elements that they were rated on.
All right, and now a couple of questions that sounds like they're up for grabs for any of you. So that first question is, how did legislative leaders react to the findings?
This is Ryan. I mean, I know for our project, it was kind of mixed because we found some disappointing outcomes, but also some really positive outcomes. Like I mentioned in the presentation, it's like I really wanted, like our team really tried to look at all of the different goals of childcare and to look at the potential outcomes and impacts that it had. But there was also kind of a push, or not a push, but like everyone was hopeful that we would find academic outcomes. But unfortunately, we just didn't really find it. And so I think some people were disappointed of that evaluation finding.
Casey or Josh, is there anything that you would like to add on your side?
This is Casey. I'm not sure I have a lot to add there. I think in general the reception was overall, it was positive. We did make a couple of recommendations around recommendations to the program around their reporting and being able to work with some of the being able to access some of the state higher education data. And so far we've learned that they are working to implement those recommendations. And so we're hopeful that that will be helpful to the legislature moving forward to have that additional information.
Excellent. Okay, now another question, again, for both of you, or all three of you. What kind of discussions took place regarding quantifying fiscal or budget impacts resulting from your work?
This is Ryan from New Mexico. It did impact the conversations that the legislature had regarding the funding. I mean, based on our findings regarding the educational outcomes, it was really hard to justify to continue to increase a lot of the funding for the program. So it wasn't increased as much as the agencies had been recommending.
This is Casey. So the Opportunity Scholarship is a public-private partnership. So it's jointly funded by private donations across the state and the legislature. And since our report, the legislature is continuing to fund the program. I think that's all I have to say about that.
All right, and then another one to you all, Casey and Josh. Does the Washington State Opportunity Scholarship provide scholarships at private institutions? And if so, did you encounter any barriers receiving or obtaining data from private institutions?
So this is Casey again. We did get data from the 10, I believe, or it was between 8 and 10 private higher education institutions across Washington. And we had to work with the organization that sort of coordinates the data for those institutions and establish separate data sharing agreements for each one of them. And we had that data linked by the state organization, the Washington Education Research and Data Center, to the public education data and the employment outcomes data. So we were able to include that in parts of our analysis. There were some limitations just because, since the private institutions don't report their data as regularly, we didn't have the same type of class level data or the class level data that we did for the publics. However, we did have good information for the financial aid data for the private schools, and it was the same information for their employment outcomes for students that attended the private institutions. And I don't know if you want to add anything to that, Josh.
I think the largest barrier about using the data from the private institutions is that it didn't have to be reported in the same capacity the public institutions do. And so different levels of data are collected, different fields. For example, they don't collect class level data at the private institutions. And so it's inherently different than the public higher education data that we received.
Excellent. It looks like we've got a few more minutes. If anyone has additional questions, feel free to type them in. I might selfishly ask a question while we wait for some of those last questions to come in. But I know here in Kansas, our office, we spend a lot of time, I'm sure like many of yours, thinking about our legislative audience and how to best present information in a way that is easy for them to digest and understand. So I'm curious, when you all work on projects like these that use pretty sophisticated methods, how those are received by legislators, and if you have any tips, tricks, or suggestions for anyone listening today on maybe ways that you all have found to be successful in terms of presenting that in a way that's easy for other people who maybe are less math or methodology inclined to understand the findings. So Ryan, if you want to take it off, we'll start with you and then kick over to Casey and Josh.
Yeah, definitely. No, that's a good question. And I don't necessarily know if I have any advanced tips or tricks or even the right answers there. I know in our office, typically what we'll do is, like, whenever we have like these advanced statistical analyses, what we'll do is we'll kind of put them in an appendix and mainly present in the main body of the report. And when we actually present to the legislatures, more or less just like kind of those mean differences or the demographic parts of it, where we can show just the differences, but we won't necessarily go into too much detail about the advanced statistical analyses that went into it.
This is Casey, and I would echo a lot of a lot of what Ryan said there. We, in our reports, they tend to be higher level reports, and so we are presenting sort of just those higher level differences rather than the, all of the methodology behind them. We do include the methodology in an appendix, and then a couple of other things other products that we produce is a one-page summary overall, or overview that we give to our members, and then we've also started doing short videos that summarize the reports. And again, those are sort of higher level, but we think they help to communicate our main points.
Excellent. Thank you for sharing. So it looks like we are about at time. So with that, I will actually move on to kind of wrapping things up. So I do, again, just want to thank Casey, Josh, and Ryan for presenting. And thanks to all of you who joined us today to listen in. This webinar has been recorded and will be made available on the NCSL website in the next week. With that, the webinar is now concluded.